Hi everyone, my name is Sarah, and today we will be presenting about Emergent Orthopedic in Residency, and this presentation by Bien, me, Suleiman, and Kainat. So just a quick overview of what we're presenting today. So we will start by just going over the general topics that we will be covering, and then we will dive into the specific injuries and the treatment of it. And I just wanted to explain these like topics may sound a bit specific, but we wanted to dive into great details on the small things so we could further understand it.
Well, emergency medicine focuses on the treatment and care of patients with urgent or life-threatening conditions. Um, some different types of emergency medicine are like urgent care, pediatrics, emergency medical services, and wilderness medicine. The pathway to a career in emergency medicine is relatively simple. First, it's 4 years of undergrad. Then you apply to medical schools and take the MCAT. And after that, you do your residency and fellowship in a specialized field.
Okay, next up is the sports medicine. So, sports medicine is a field that focuses on prevention, diagnosis, rehab, and injuries, uh, and conditions that are related to physical activity. And because sports medicine is such a general field, the pathway depends on the specific topic. And there are many subspecialties, including sports radiology, uh, psychology, physiology, cardiology, and etc., that have minor differences in their pathway. For example, a sports orthopedic surgeon, for example, has to go through about 14 to 60 years of education and training. And for anyone who doesn't know what orthopedics mean, it can be broken down into two pieces. Ortho meaning like straight and correcting, and pedics just meaning children from pediatrics. So this study started from fixing skeletal deformities in children, but now it applies to anyone. And the salary ranges from 400K to 700K in the US. And just a general overview of the pathway for orthopedics, it starts with 4 years of undergrad and then medical school, and then about 5 to 6 years of residency. And here the students slowly transition from educational preparation to hands-on training, especially in treatment of musculoskeletal conditions. And then comes the fellowship, where students are able to further their training in a subspecialty like an or sports orthopedic surgeon with more hands-on experience. And finally, to become an official orthopedic surgeon, student has to obtain board certification from the American Board of Orthopedic Surgeon or Surgery, and this includes a series of written and oral examination that tests your proficiency in surgical knowledge and decisions.
And now we'll be moving on to residency. So in our first meeting, we covered residency very briefly, but it is a program where physicians complete it after graduating medical school, typically taking place in a hospital or an academic center. And this is where medical students who have graduated will be supervised while performing the duties of an attending doctor, and this training helps prepare them to practice their specialty without supervision in the future. It helps medical students develop professionalism, confidence, clinical judgment, and experience in patient care. And for patient care, what that entails is like direct patient care, so seeing surgical consults. And these people will determine whether or not a patient needs surgery, which is really important in orthopedics, and sports medicine in general. They'll be rounding on hospitalized patients, which means they'll be going around the hospital and seeing all the patients and making sure that they're taken care of. And they'll be observing and performing bedside procedures, which include like blood transfusions, chest tube insertions, and declotting procedures. And medical students apply for residency typically in the fourth year of their medical school journey. And the match process, where they're matched to a specific residency, does take around a month. And of course, practicing direct patient care that we just went over, diagnosing and controlling, and also treating medical issues. Residency typically lasts around 3 to 7 years, based on the medical specialty that a medical student chooses. And for orthopedic surgery residency in specific, it is around 5 years long.
The first case study we did was burns. There's like three stages of burns. The first stage is like a first degree burn. It's not very serious. It just leaves a burn site sore and red. This can happen because like you spilled like hot tea on yourself or other hot liquids, or maybe even just like warm plate. And then the second type of burn is a second degree burn, which is slightly more serious, and it leaves a burn site like blister and sore. And this can happen when you like spill even hotter things on yourself, such as like hot oil or like boiling water. And then the third and most serious type of burn is third degree burn, which is very serious. This happens when you're burned severely in a fire or similar place. It usually leaves a burn site very deformed. You will need a skin graft, and it burns the nerve endings, so you won't be able to feel your burn, and it leaves a bone like charred and very damaged. Yeah, and then there's um four ways that you can get burns. The first one is thermal burns, which are like burns from external heat sources, such as stoves or hot water, hot liquids. The second type is radiation burns, which is from like UV light, such as the sun. So it's like sunburn essentially. The third type is chemical burns, which could happen when you are working in chemistry. You could spill like a chemical solvent on yourself, and then you get like acid burns. And then the fourth type is electrical burns, which comes from like an electric current. And then to treat burns, you usually have a team of specialists that help you come up with a treatment plan. This team of specialists will sometimes consist of like a plastic surgeon, depending on how severe the burn is, or a psychologist. If you like have psychological damage and need to talk to somebody about your burn, I guess, and then occupational therapists to help the patient like recover their movement in the area that was burned, physical therapists that like help you recover muscle strength in your body, and nurses who specialize in burn care so that the burn site doesn't get infected and they apply cream. And this should help the patient move on and to their normal life and help them recover from their injury.
Right. And now we'll be going over the tennis elbow, which is a condition that sometimes occurs in sports medicine. It's pretty common, and occurs when patients continuously perform like a repetitive motion. So for example, you see that a lot in tennis, like forehand or backhand. You see that a lot in golf, and for example, like baseball. So the extra stress on an elbow will damage the tendons that connect the forearm muscles to the elbow. Um, so because it's a repetitive motion, this is classified as a repetitive strain injury. And this causes pain and inflammation in the elbow. Like mentioned before, it is pretty common. So around 3% of the people in the United States experience tennis elbow each year. And it's one of the most common causes of elbow pain. Tennis elbow typically occurs in people who put stress on their arms or elbows. So, like mentioned, sports like tennis and baseball and golf. But it's also common in different like careers, like painters and musicians and carpenters and chefs who are doing a lot of like repetitive motions that require a lot of physical exertion or effort. Um, and it is like inflammation in the extensor muscle cords. So those are the cords that connect the muscles in your forearm and your hand to the bones in your fingers and the thumb. And it is a lateral type of inflammation. So it's on the lateral side, or like to the side of your body and away from the middle of your body. And then you can see a few pictures of how it works. So of course, the stress on your tendons, and that affects your elbow movement. For treatments for tennis elbow, doctors will diagnose it by asking about like patient symptoms. So that'll include like elbow pain, stiffness, swelling, weakened grip, and pain that's like sharp and it radiates from your elbow. So those are all symptoms of tennis elbow. And they may also conduct a physical exam just to be sure that that is the condition that you have. And that can also include imaging to see the damaged tendon. So they might be conducting elbow x-rays, ultrasounds, MRIs, or EMGs. And this is also seen in residency. So resident doctors will have to learn about tennis elbow treatments, especially since it's so common going into this field, and especially those who are becoming primary care doctors or orthopedic doctors. So tennis elbow can be treated using resting, applying ice, wrapping like a compression bandage around the elbow, and keeping the elbow elevated. So that does fall into what is considered the Rice method. So R being resting from activities that cause this condition, I being icing the elbow multiple times a day for anywhere between 15 and 20 minutes. And then you have elevating your elbow to be like above your heart. There are non-surgical treatments that include pain relievers, physical therapy, elbow and wrist braces, platelet-rich plasma, corticosteroids, sternotomy, and shockwave therapy. So going deeper into each of those, pain relievers include over-the-counter medications that help relieve pain and reduce swelling. Physical therapy does help strengthen muscles in and around your elbow, so that increases flexibility in your arm and can possibly help relieve the pain that comes from this condition. And wearing a brace that enables your tendons to like rest and help with the healing process. Platelet-rich plasma is a procedure where there's a sample of blood taken from your arm or your body, and that's processed to concentrate platelets, which are proteins found in your body that help your body heal. And then after they concentrate those platelets in that blood sample, they'll inject it back into your elbow, and that encourages your elbows and your tendons to heal. Corticosteroids are anti-inflammatory medicine. So you mentioned how tennis elbow is an inflammation in your tendons. And that can also come as cortisone shots that are injected into your injured elbow to ensure that the inflamed area does go down. Um, Sternotomy is when a needle is poked into your skin and then into the injured tendon. And the ultrasound like guides the direction that the needle is going in. The purpose is to kind of break down and remove the damaged tissue in the tendon and the elbow, and then that allows your body to heal. Shockwave therapy is then like when a specific pressure frequency is applied to your injured tendon, and then those shock waves will kind of like push and encourage your body to speed up the healing process. And there are surgical treatments for tennis elbow. Those include open surgery, arthroscopic, and keyhole surgery. So, open surgery is when a surgeon will make a single cut right over the injured tendon. They'll scrape away the unhealthy or the damaged part of the tendon, and then that tendon will be repaired with either a suture anchor, um, or it'll be stitched, the tendon will be stitched to other tendons. And a suture anchor is basically just a surgical device that will attach tendons and other soft tissues to a bone. Arthroscopic surgery is when a surgeon makes one or two small cuts and then inserts an arthroscope, which is kind of like a thin tube with a very small camera at the end that acts as a video monitor. And it also has a light, so the surgeon will be able to see inside your elbow area, and that allows them to like scrape away the unhealthy part of your tendon. And keyhole surgery is super similar to arthroscopic surgery, but it involves a few small incisions instead of one or two. And that goes around the elbow before the arthroscope, so the thin tube with the camera is inserted. They'll examine the elbow and the damaged tendon, and then the surgeon will, of course, scrape away the damaged and unhealthy parts, as they would do in an arthroscopic surgery.
Okay. Now we'll be going over the open fracture injury. So what is it? Just as it's worded, it's just like an injury or a fracture that involves the bone literally poking out of your skin. And compared to the closed fracture, there's a higher risk of infection because the bone is literally sticking out and you can see the inside of your skin. And this involves a risk of contamination, including anything that's nearby, including glass, dirt, mud, clothes, and etc. And the causes of it is usually anything that involves high energy activities, for example, football, soccer, and gymnastics. And the severity of it really matters in the size and the number of it. So, open fracture, there can be multiple fracture within the fracture. And location also matters a lot because you may already know, but like the minor fractures in your fingers or anything, they usually give you like a braces or cast to just heal by itself. And this works because bones are vascular, meaning they have blood supply. So when they're fractured, the bloods can form blood clots to heal by itself, which I think is really convenient. But when the location for open fracture is near like a vein or something and it has inadequate amount of blood supply, they can't heal by itself because they don't have enough blood for blood clots. And this is called non-union, and this can complicate the surgery furthermore. And they usually have to bring in like bone graft from other parts of your body and also damage to surrounding soft tissues just because it's not just a broken bone. It also damages your skin and pierces through. So how much your skin is damaged matters a lot. And then for the treatment for open fracture, they first try to quickly do a physical examination of how and where the injury occurred and their medical history with like allergies and this stuff, and also x-rays because as I said, open fracture, it's not just a part that's like the bone is piercing through. There may be fractures in other parts of the body that was involved with it. So just to make sure they do x-rays. And then as I talk about it, infection is a big part of this injury. So they try to take it seriously by giving out antibiotics and also tetanus booster, which is tetanus is just the infection and infections in nervous system, and they try to avoid that by giving out antibiotics specific for that. And then the procedure, the actual surgery itself involves the debridement and irrigation. Debridement is just removing all the foreign materials that is inside the body, and then irrigation just using fluid to take out all the foreign materials with like fluid. And internal fixation, when they're actually doing the surgery, they try to stabilize it by using metal plates to just stabilize the bone itself. And for a more extreme version, it involves external fixation where they have to stabilize the whole body part itself by screwing metal plates literally outside your skin. And the recovery involves the treatment is not just the surgery itself, it also involves what is done after the surgery. So physical therapy is an important, crucial part of recovery. And in the time frame, it really matters on the severity of injury. So sometimes it can take more than a year.
Hi guys, my name is Kainat, and please don't mind my voice. I'm a bit sick. So for concussions, a concussion is a mild traumatic brain injury that results from the brain being shaken inside the skull, and it could also disrupt normal brain function, leading to temporary cognitive and physical and emotional symptoms. It's also classified as mild brain injury because it's not usually life-threatening, but the effect can still be serious and long-lasting, especially if not properly managed. So, concussions are often caused by impacts to the head or violent shaking, like, for example, falls in contact sports like soccer, hockey, football, and vehicle accidents, fights, physical assaults, all of that. So, even if the head is not directly hit, a strong jolt can cause the brain to move and result in a concussion. Uh, Concussions are usually treated uh, with rest and recovery because their symptoms are usually physical headaches, dizziness, nauseous, vomiting, balance issues, and blurry vision. There are much more, but these are the ones I listed. And cognitive symptoms would be difficulty in concentrating, and memory problems, confusion, feeling mentally foggy, and for the emotional symptoms, it's usually irritability, sadness, anxiety, or nervousness. And it also disrupts sleeping. So trouble falling asleep, sleeping too much, or feeling drowsy. Symptoms may not appear immediately, but they will develop like by hours or days after the injury. So treatments for concussions are usually rest and recovery. Those are the first things that are recommended. And physical rest is very much important. So avoiding physical activities like sports, running, or lifting. And cognitive rest, so it limits activities that require thinking, concentrating, or screen use. For example, being on your phone, reading, or computer work. So gradual returns to normal activities are usually after symptoms improve slowly. You reintroduce the activities under a doctor's supervision. So resuming the sports or physical activities too soon increases the risk of a re-injury. And avoiding alcohol and drugs during recovery as they may slow healing. So there are many different doctors involved in a concussion. Usually it's neurologists, which is like experts in brain and nervous systems. They manage more severe ones, but the primary care physicians are the ones who often the first to assess the injury, providing initial treatment advice and track recovery progress. And sports medicine doctors also specializes in concussions because it usually happens during sports. So the for the long-term outlook in concussions, it is usually a full recovery. So most individuals recover within few weeks with proper rest and care, but recovery time varies by age and the severity of the concussion. So for the post-concussion syndrome, which is also called PCS, in some cases symptoms last for weeks or months, known as PCS, which may require additional treatment or therapy. And for multiple concussions, some people experiencing multiple concussions over time, especially in supports, increases the risk of a long-term complications such as memory loss, mood disorder, and in rare cases, it's CTE, which is chronic traumatic encephalopathy, which is a the degenerative brain disease. And I got most of these information from Mayo Clinic Health System. And you can take a look at Harvard Medical Publication for more information about the long term outlooks. Thank you.
Okay. And thank you all for listening. And this is the works cited, all the sites that we use. And yeah, thank you all for listening. And is there any questions? Okay. I don't think I can see the chat, so let me know if you guys have any questions by speaking up. Okay. If you guys don't have any questions, we have Kahoot. So if you guys want to join that, please join. And also, can you guys hear the sound for Kahoot? Okay. I know it's a small thing, but I like the sound of the Kahoot thing, so I'll try to figure out. Can you guys hear it now? Okay. Okay. I think you guys can hear it now. Okay, that's good. Thank you. Um, there's a limit of 40 participants, so if there's more than 40 people, it's just the first 40 people. Oh, sorry, I accidentally clicked on some of you guys. Sorry, if you guys got kicked out, please rejoin. And someone who like annotated the screen, if they can remove that, that would be great. Like people who took like notes for it, I think that's really good. But if you guys can delete it on the shared screen. Okay. You guys can join during the game, so I'll just get started right now. Okay, good job. Most of you guys got that one right. Okay, Nicole's on the first place. Okay, yeah. This wording's kind of bad, but yeah, MCAT is required. It's not just recommended, so watch out for that. Okay, good job. Let's go. Okay, yeah, it's right after medical school, so yeah. That's second degree burn. Yeah, so it's not always, but it usually appears white when it's third degree and red when it's second degree. Good job. Yeah, so it includes radiation that's emitted by machines, but it also includes like sunburns, which is not a machine. Yeah. Good job. Yeah. Yeah. The first one is also right, but all of them are right. Yeah. All of these apply, but this one is like a specific to open fracture and not in the closed fracture. you don't need to like directly hit the head. You could hit somewhere else and like move your head strongly and get a concussion too. And last one. Okay. Congratulations to all the winners, and thank you guys for listening to the presentation. And special thanks to all the interns, Suleiman, Hannah, Yen, for helping with the presentation.